Hello, welcome back. In this video, we're going to go over the publication on ergonomics from OSHA, what they did about it. Now, this is 2000. That's when they did their big OSHA thing. So, but it really doesn't it survives the test of time. It's not old as far as it goes. The information in it's not old, and but this will give you an idea of what OSHA was thinking and what they were looking at when they did their attempt at making a OSHA standard. So we're going to go back into this and share it and start it. I think I'm going to start it. All right, I think I got it. Okay. Now this particular right side of this is the study of this document. If you download it from the OSHA website, that's what you're going to see, this iconic picture here of a person, guy, whatever. And it's called OSHA's Ergonomics, the Study of Work. Definitions, they're going to throw some at us right off the bat. Anthropometry, which we're going to study in the next chapter, the study of human body measurements. I'm not going to go into this in a lot of detail, though. Biomechanics, we're going to talk about that too. We got a whole chapter on that. The scientific and engineering field explains the characteristics of biological systems, the human body, in mechanical terms. Carpal tunnel syndrome, compression and entrapment of the median nerve where it passes through the wrist into the hands. We're going to talk about that in detail. Descartes disease, inflammation of the tendon sheath of the thumb, attributed to excessive friction between two thumb tendons and their common sheath, usually caused by twisting and forcefully gripping motions with the hands. Industrial hygiene, the science of anticipating, recognizing, evaluating, and controlling workplace conditions that may cause worker injuries and illness. Usually when you think of industrial hygiene, you think of the health as far as the toxic gases and substances in the workplace. Kinesiology, the study of the principles of mechanics and anatomy in relation to human movement. Musculoskeletal disorders, injuries and disorders of the soft tissue, muscles, tendons, ligaments, joints, and cartilage, and nervous system, as opposed to like a broken bone. Raynaud's syndrome or white finger blood vessels of the hand are damaged from repeated exposure to vibration for long periods of time. The skin and muscle do not get the necessary oxygen from the blood and eventually die. Symptoms include intermittent numbness and tingling in the fingers, pale, ashen, and cool skin, and the eventual loss of sensation and control of the hands and fingers. I'm sure we've all had some kind of sensations of numbness in the fingers when doing something for a while, but we quit doing it and it goes away. Tendonitis is tendon inflammation occurring when a muscle or tendon is repeatedly tensed from overuse or unaccustomed use of the wrist and shoulder. Tenosynovitis, inflammation or injury of the synovial sheath surrounding the tendon, usually results from excessive repetitive motion. Trigger finger, a tendon disorder that occurs when there is a groove in the flexing tendon of the finger. If the tendon becomes locked in the sheath, attempts to move the finger can cause snapping and jerky movements, usually associated with tools that have handles with hard or sharp edges. This is one thing of all these symptoms we talk about that I personally know something about, because I've had surgery for trigger finger about 5 times on both my hands on different fingers. And I don't know why they keep saying this is I never did it from work, both hands. So I'm right-handed. So I don't know. I think it's hereditary because my mom had the same issue. So I don't know on trigger finger that these people are know what they're talking about, basically. So what's ergonomics? Simply, it's the study of work. Science of designing the job to fit the worker rather than physically forcing the worker's body to fit the job. Adapting tasks, workstations, tools, and equipment to fit the worker can help reduce physical stress. Now, this is important. You're not going to just change like one little thing. The task itself, maybe, the workstation where they work, the tools they use, equipment that they have, a lot of things can be adapted to fit the worker. And they can help reduce physical stress on a worker's body and eliminate many potentially serious disabling work-related musculoskeletal disorders. These things aren't to be taken lightly, believe me. They're painful and they could be disabling. Ergonomics draws on a number of scientific disciplines, including physiology, biomechanics, psychology, even anthropometry, industrial hygiene, and kinesiology. Employers or employees in manufacturing, construction, maritime, agriculture, they need to know about ergonomics. Like I said before, if you have employees and they move or they don't move, you need to know about ergonomics. And these are some industries whose work and activities the OSHA thinks that they should be aware of ergonomics. Repeating the same motion throughout your workday. That's basic ergonomics 101 is repetitive motion. Awkward posture positions. Again, that's where we're at right now. Ergonomics 101. Lifting awkward or heavy items. That's a problem. Excessive force to perform tasks. Being exposed to excessive vibration and temperatures. Industries increasingly require higher production rates and advances in technology to remain competitive and stay in business. As a result, jobs today can involve frequent lifting, carrying, pushing, or pulling loads without help from other workers or devices. Increased specialization that requires workers to perform only one function or movement for a long period of time, day after day. It goes back to the old assembly line where you stand there and you put this wheel on, these bolts on every day, all day. Working more than 8 hours a day. In some industry, that's pretty common. Working at a quicker pace of work, such as faster assembly line speeds, and having tighter grips when using tools. These factors, coupled with poor machine design, tool and workplace designs, or the use of improper tools, create physical stress on workers' bodies, which can lead to injury. A dramatic increase in musculoskeletal disorders began in the 1970s, when these disorders increasingly appeared on companies' injuries and illness logs. OSHA cited companies for hazardous workplace conditions that cause problems such as tendinitis, carpal tunnel syndrome, and back injuries. And as you know, there's no OSHA standard. So what did they cite them under when they did? You got it, the 5A1 or the general duty clause. The Bureau of Labor Statistics recognizes MSDs as a serious workplace health hazard. These injuries now account for more than 1/3 of all lost workday cases. When they say lost workday, that means you've lost work. And that elevates an injury, like, you go and get a couple stitches. Yeah, that's OSHA recordable and everything, but usually it's not that big a deal. But when you start losing work and your employees start losing work from your injuries, that takes it almost to a whole new level. That gets pretty serious. If work tasks and equipment do not include ergonomic principles in their design, workers may have to have exposure to undue physical stress, strain, and overexertion, including vibration, awkward postures, forceful exertions, repetitive motion, heavy lifting. But recognizing ergonomic risk factors in the workplace is an essential first step in correcting hazards and improving worker protection. Worker protection, that's what OSHA is all about, right? And so are we. Ergonomics, industrial engineers, occupational safety and health professionals, and other trained individuals believe that reducing physical stress in the workplace could eliminate up to half of the serious injuries each year. Employers can learn to anticipate what might go wrong and alter tools and the work environment to make tasks safer for their workers. MSDs, or musculoskeletal disorders, are injuries and disorders of the soft tissue we talked about before, and nervous system. They can affect nearly all tissues, including the nerves and tendon sheaths, and most frequently, though, involve the arms and the back. And that's where most of your repetitive motion comes in. That's where your force is usually involving your arms and your back. They're also called these, we've talked about those already. So these painful and often disabling injuries generally develop over weeks, months, and sometimes even years. They usually result from exposure to multiple risk factors that can cause or exacerbate the disorders, and not from a single event or trauma, so not such as a fall, collision, or entanglement. So they're coming result from exposure over a long period of time, or doing something over a long period of time. And they can cause a number of conditions: pain, numbness, tingling, stiff joints, difficult moving, muscle loss, and sometimes even paralysis. Frequently, workers must lose time from work to recover, and some never regain full health. Usually when you're losing time for work on these, probably because you're having surgery. These disorders include carpal tunnel syndrome, tendinitis, sciatica, herniated discs, and low back pain. MSDs do not include injuries resulting from slips, trips, and falls, that type of thing. What causes them? They occur when the physical capabilities of the worker do not match the physical requirements of the job. It's a difficult thing to do, match the job and the worker. And frequently it's impossible to do, and at least until you find out afterwards that it didn't work. Prolonged exposure to ergonomic risk factors can cause damage to a worker's body and lead to musculoskeletal disorders. Conditions that are likely to cause MSD problems include the following: exerting excessive force, excessive repetition of movements that can irritate tendons and increase pressure on nerves, awkward postures or unsupported positions that can stretch physical limits and compress nerves and irritate tendons. And that's probably the big three in ergonomics: awkward postures, repetition, and force. There's other factors, of course, but those are the big three. Static postures sometimes, or positions that a worker must hold for long periods of time, can restrict blood flow and damage muscles. And motion, such as increased speed or acceleration when bending or twisting, can increase the amount of force exerted on the body. Compression from grasping sharp edges like tool handles can concentrate force on small areas of the body, reducing blood flow and nerve transmission, damage tendons and tendon sheaths. Inadequate recovery time due to overtime, lack of breaks, and failure to vary tasks can leave insufficient time for tissue repair. Inadequate recovery is another big factor too. Microtraumas are going to happen, and they happen all the time, but you got to have time to recover from them. So if you start today's work not having recovered from yesterday's microtraumas, you're just going to build on that. Conditions that are likely to cause MSD problems include these following: these: excessive vibration, usually from vibrating tools, that can decrease blood flow, damage nerves, and contribute to muscle fatigue. Whole body vibrations, driving trucks and operating subways, can affect skeletal muscles and cause low back pain. So if you're taking the subway in Fort Smith, you may want to think about that. Oops, I got off track here. Okay. There we go. Working in cold temperatures can adversely affect a worker's coordination and manual dexterity and cause a worker to use more force than necessary to perform a task. These risk factors, either alone or in combination, they can be frequently do all happen together, can subject workers' shoulders, arms, hands, wrists, and backs and legs to thousands of repetitive twisting, forceful, or flexing motions during a typical work day. To contribute to MSDS, however, these risk factors must be present for a sufficient duration, frequency, and magnitude. So if they just happen once in a while, no. They have to be there for enough time to cause harm. And that varies with a lot of factors, person to person too, how much force, how much of each of these. Could non-work related factors cause MSDSs? Yes, risk factors not related to your job can cause or contribute to musculoskeletal disorders. These factors include physical conditioning. How fit are you? Medical conditions such as obesity, diabetes, arthritis, pregnancy, hobbies that are hand intensive or require manual handling. In these instances, usually because someone can control the duration of exposure, hobbies usually are not a primary risk factor. And psychological or social workplace stress. MSDs affect workers in almost every occupation and industry and in workplaces of all sizes, so not just big companies or medium-sized companies. They occur most frequently in jobs that involve manual handling, manufacturing and production. Production is a big one. Heavy lifting, twisting movements, and long hours of working in awkward positions. How do you know if you have an MSD? Do you experience any of these? Numbness in your fingers or your thighs, difficulty moving your finger, stiff joints, back pain. MSDs can affect nearly all tissues of the body: nerves, tendons, sheaths, and muscles. The most frequently affected are the arms and back, because there's what you use most of the time when you're working. Tendon disorders such as tendonitis, tenosynovitis, Baker-Veins disease, trigger finger, and carpal tunnel syndrome are the most common occupational MSDs associated with the arm. Tendon disorders are very common and often occur at or near joints where the tendons rub against other tendons, ligaments, or bones. We'll talk about a lot of this stuff later on too. The most frequently noted symptoms of tendon disorder are a dull, aching sensation over the tendon, discomfort with specific movements, and tenderness to the touch. Recovery is usually slow, as the condition may easily become chronic if the physical stresses causing the problem are not eliminated or reduced. Another MSD that has received increased attention lately is carpal tunnel syndrome, or CTS, which affects the hands and the wrists. CTS is the compression and entrapment of the median nerve where it passes through the wrist into the hand in the carpal tunnel. When I worked in a cut and sew operation, sewing machine operators who were doing the same thing day after day, every day for 8 hours at least, they had a lot of carpal tunnel syndrome. And it was very painful, but once they had surgery and recovered from surgery, came back to work, they were just as good as new, really. The median nerve is the main nerve that extends down the arm to the hand and provides a sense of touch in the thumb, index finger, middle finger, and half the fourth finger or ring finger for some reason. When irritated, tendons housed inside the narrow carpal tunnel swell and press against the nearby median nerve. The pressure causes tingling, numbness, or severe pain in the wrist and hand, often felt while sleeping even. The pressure also results in a lack of strength in the hand and an ability to make a fist, hold objects, or perform other manual tasks. If the pressure continues, it can damage the nerve, causing permanent loss of sensation or even partial paralysis. CTS develops in the hands and wrists from repetitive and forceful manual tasks performed without time to recover. Again, any worker whose jobs demand a lot of repetitive wrist, hand, and arm motion, not necessarily forceful. The sewing machine operators had to hold the material, of course, but it was just doing it. It wasn't that forceful, but it was just doing it over and over again. And I don't want to downplay the severity of that. It was very painful for them, and they still had to have surgery, and that's painful and recovery. So even though the recovery was pretty good when they were done, they went through a lot of pain to get there. There's your transverse carpal ligament, the median nerve, flexor tendons, and the small bones of the wrist, showing where that nerve goes through the carpal tunnel. So what part of the body are most affected? What parts of the body? Back injuries, and that is a big one too. Workers cite back disorders most often after the common cold and flu as reasons for missing work. The most common back problems are pull or strain muscles, ligaments, and tendons. Most serious disorders involve spinal discs. So everybody probably has at one time or other pulled or strained a muscle in their back. But spinal disc problems, injuries are very, very serious. More than half the workforce experiences back pain at least once during a lifetime. It's probably more higher than that, I'll bet. When repetitive pulling and straining injuries, back muscles or ligaments, injures back muscles or ligaments, the back muscles, discs, and ligaments can become scarred and weaken and lose their ability to support the back. This makes additional injuries more likely. Many solutions to ergonomic problems in the workplace are simple and inexpensive. For example, awkward and uncomfortable position can be eliminated by adjusting the height of the work surfaces, perhaps. Providing telephone headsets to somebody that's answering the phone all the time. Supply anti-fatigue mats. Varying the tasks. Don't be doing the same thing all the time. Short breaks. Doesn't have this 5 minutes an hour. Sometimes is enough, but short breaks to keep from doing that same thing all the time. Give you some recovery time during the day. Reducing the weight and size of items workers must lift. Putting supplies and equipment within easy reach of the worker. Providing ergonomic chairs or stools. And supplying the right tool for the job and the right handle for the worker as well. Good ergonomics is good economics. That's true. How can ergonomics help my workplace? Providing a workplace free of ergonomic hazards can do the following. Lower injury rates as musculoskeletal disorders, incidents go down. It's always good. Increase productivity by making jobs easier and more comfortable. People might work a little better. Improve quality because fewer errors will be made when using automated processes that demand less physical effort. And also improve quality because the person who's filling in for your A team, so to speak, might not do as good a job. Reduced absences because workers will be less likely to take time off to recover from muscle soreness, fatigue, and MSDS-related problems. Reduce turnover as new hires are more likely to find an ergonomically designed job within their physical capability. Lower cost as workers' compensation and other payments for illness and replacement workers go down. And everybody wants to lower costs. Improve worker safety, increase worker comfort, reduce worker fatigue, and improve worker morale. Don't downplay that, as I said before. What can I do to detect and prevent ergonomic hazards at my workplace? Well, they're not often easy to prevent. If you're an employer whose workplace poses ergonomic risk factors and whose workers report MSDs, you can address this problem by establishing an ergonomics program. We'll talk about that. Providing and encouraging employees to participate in the program and participate in decisions affecting their safety and health. Getting your employees involved in safety is a really good thing to do. If you're an employee who's exposed to ergonomic risk factors, you should participate in your employer's ergonomics program and provide feedback to your supervisors and employers through available channels, such as an established employee safety and health committee. If they have one, if they didn't, you should try to get them to get one. Effective ergonomic programs should include the following elements: management commitment and employee participation, job hazard analysis, controlling ergonomic risk, MSD management, and training and education. This is some examples of musculoskeletal disorders. We're going to show the body part affected, the symptoms, possible causes, what kind of workers are affected, and what it's called. So the thumbs, it's pain at the base of the thumbs, a symptom. Twisting and gripping are the possible causes, and usually butchers, housekeepers, packers, seamstresses. That's what I just said. Sewing machine operators, seamstresses, cutters, people cutting things all the time. And that's called Baker-Vein's disease. Fingers, difficulty moving fingers, snapping, jerky movements. That's the symptoms. Repeated use, their causes. Meat packers, poultry workers, carpenters, electronic assemblers, trigger finger. Shoulders, pain or stiffness in the shoulders. Possible causes, working with the hands above the head. What is that called? Awkward posture. Power press operators, welders, painters, assembly line workers, and rotator cuff tendonitis is the disordered name. Hands and wrists, symptoms are pain and swelling. Repetitive or forceful hand and wrist motion are the possible causes. Core making, poultry processing, meat packing, and that's called tenosynovitis. Anybody that's using their hands particularly forcefully. Part of the body affected, fingers and hands. Symptom numbness, tingling, ashen skin, loss of feeling and control. Could be exposure to vibration, chainsaw, pneumatic hammer, gasoline powered tool operators. And that's a lot of times leads to Raynaud syndrome or white finger. Again, fingers and wrists, tingling, numbness, severe pain, loss of strength, sensation in the thumbs, index or middle or half of the ring fingers. Possible causes, repetitive and forceful manual tasks without time to recover. Meat, poultry, and garment workers, upholsterers, assemblers, VDT operators, cashiers, carpal tunnel syndrome. There's a lot of occupations that are subject to carpal tunnel syndrome. Back issues, low back pain, shooting pain, or numbness in the upper legs. Possible cause, whole body vibration, and that's limited to people that are usually in things that vibrate. A job hazard analysis identifies job problems and risk factors associated with them. This helps employers determine what jobs and workstations are the source of the greater problems. The most effective worksite analysis include all jobs, operations, and work activities where there are ergonomic risk factors, regardless of whether the employer's medical records indicate that workers have developed MSDs. A thorough job analysis is important to successfully prevent or reduce the various MSD hazards at the worksite. Workers exposed to ergonomic risk factors may develop a variety of symptoms. Moreover, a combination of factors in a single job or workstation may cause MSDs. Remember, there could be more than one risk factor. For example, research has shown that various symptoms among VDT operators resulting from problems in equipment, workstations, the office environment, and job design are a combination of these. That's an odd choice of words here by OSHA, video display tube operators. Usually they're data entry people they're talking about here, and they could be problems. There could be problems with them. In addition, VDT operators experience not just one simple MSD, but often eye strain, headache, and excessive fatigue, as well as neck, back, and muscle strain and stress. A comprehensive analysis of the worksite will identify the interplay of how various ergonomic risk factors in place affect workers. How can I control ergonomic risk factors? Properly designing the job or workstation and selecting the appropriate tools or equipment for that job. And based on information from the job analysis, an employer can establish procedures to correct or control risk factors by using appropriate engineering controls, such as workstation, tool, and equipment design or redesign, work practices, such as proper lifting techniques and keeping work areas clean, administrative controls, such as worker rotation, more task variety and increased rest breaks if necessary, and personal protective equipment, such as knee pads, vibration gloves, and similar devices. Usually when it comes to ergonomics, there's not a lot of personal protective equipment that you can use in ergonomics. These are a few of them. But when talking about vibration gloves, not just regular gloves, these are special gloves that are made for vibration. The National Institute for Occupational Safety and Health, which we all know as NIOSH, recommends the following guidelines in jobs requiring manual handling. Minimize the distance between the load and the body. In other words, why don't they just say what everybody else says? Keep the load close to the body when you're carrying it. Lift loads from the knuckle height if you can. When you're standing up, that's the best place. But remember, what's your power zone? Knuckles to shoulders. Keep the travel distance from lift to less than 10 feet. In other words, don't be walking around all day with something. Minimize twisting. Twisting while you're lifting it and carrying it is not a good idea. Provide good handles for grasping tools. That's called coupling, and we'll talk about that in more detail later. It's also important that work tools and equipment be ergonomically designed. Most hand tools are designed for only occasional use, not for repetitive use over prolonged periods. When acquiring tools for regular use in an industrial setting, an employer should consider the following ergonomic features. Tools should be lightweight and handles designed to allow a relaxed grip so the wrist can remain straight. In other words, you want to keep your wrist like this, not up, down, in, out. Tools should be designed for use with either hand and be of various sizes so they're appropriate for all workers. Chances are when you buy a tool, you're not going to buy a tool to fit this particular worker. A lot of workers are going to need it, maybe on different shifts. Tool handles should be shaped so they contact the largest possible surface of the inner hand and fingers. Avoid tool handles with sharp edges and corners. Use power tools to reduce the amount of human force and repetition required. Purchase low vibration tools to reduce tool vibration, and if necessary, fit absorbent rubber sleeves over the tool handle. Maintenance of tools and equipment also is essential in preventing or reducing ergonomic hazards. Keep tools sharp and maintain them according to the manufacturer's specifications. Proper maintenance can also help reduce vibration resulting from prolonged equipment operation. MSD management is another important element of an effective ergonomics program. Proper MSD management focuses on early identification and evaluation of signs and symptoms of musculoskeletal disorders and helps eliminate and reduce the risk of developing them. Employers should include the following elements in a MSD management program. Injury and illness record keeping. You got to have that. That's an OSHA requirement. So, of course, this is OSHA. So, early recognition and reporting of MSD symptoms. This is something that is very important. I told you before we had a lot of ergonomic issues in the chicken business. They come up with a program of when early recognition. We wanted people to tell us when they have problems, and when they did, we would put them in a different job for 2 weeks. Now we didn't call this a job transfer because he kept them in the same department, and so we just moved them away and give them to do something else for a while to relieve that pain that they're having, and that worked, and that actually decreased the amount of reported potential musculoskeletal disorders by 75%. Systematic evaluation and referral to a qualified healthcare provider. And don't overlook these people. As a safety person, you're probably going to be working somewhat closely with some kind of a professional healthcare provider, a doctor at the clinic, or nurse practitioner. And don't overlook those people and take what they say and try to do what they say. Conservative treatment, such as restricted duty jobs when necessary. Conservative return to work. That's what we call it, conservative treatment. We put them to strict little other jobs. Systematic monitoring, including periodic workplace walkthroughs. That's one of the best parts of being a safety professional is doing the walkthroughs. I like doing those. Adequate staffing and facilities where employees provide on-site evaluations. Employee training and education. Train your people, educate them, let them know to report things. Almost any injury, almost any kind of injury, the sooner you get it reported, the sooner you can get something done about it, and the less serious the outcome will be. Now, I know sometimes people in management don't want to report it because it's going to go on our OSHA log and look bad for us. No, they need to get it reported because it means it get taken care of. It's not going to go away. If it's a a musculoskeletal disorder in the making, it is not going to go away. There's only one way it can get, and that's worse. Access to healthcare providers for each work shift. Yeah, that'd be nice to have. But okay, who's had nurses at the main facilities. No barriers to early reporting. OSHA likes this, and I do too. And I found that over experience too. The early reporting helps. It helps the employer, helps the employee, it helps everybody. Try to get your employees to report stuff, any kind of accident. Training programs go a long way toward increasing safety awareness among managers and supervisors, designers, buyers, mechanics, and workers who perform jobs. And training and education ensures that employers sufficiently inform workers about ergonomic risk factors at their work sites so they're better able to participate actively in their own protection. Suggestions and input from workers aware of ergonomic risk factors can be very helpful in designing improved workplaces to reduce MSD hazards. Good ergonomics training program will teach employees how to properly use equipment, tools, and machine controls, as well as the correct way to perform job tasks. For example, employees should encourage work methods that allow workers to keep their joints in a neutral position, such as wrist straight and elbows bent at a right angle, while using tools requiring manual force to prevent excessive force on joints and tendons. Employers should also tell workers to avoid all side-to-side twisting and quick motions of their wrists and keep their hands in line with their forearms while using tools and operating equipment. Employers should provide the appropriate controls or tools as necessary to reduce or eliminate awkward positions. To minimize and prevent back disorders, employers should teach workers to avoid long reaches, maintain neutral postures, and use proper lifting techniques. Using correct posture is important whether an employee is sitting, standing, pulling, pushing, lifting, or using tools or equipment. Training workers in general lifting techniques can also help reduce the strain leading to back disorders. For example, employees should use their leg muscles and bend their knees to pick up and lower heavy loads. Providing appropriate equipment such as conveyors or carts, lift tables, and lift assists can also reduce load weight, minimizing incorrect lifting and potential injury. Those help a lot. If you're an employer who has identified the needs for an ergonomic program at your work site, start by planning the program and the goals and put it into action. All right, since this is an OSHA publication, they encourage contacting the OSHA office. Of course, they want to do that. There is an outfit called OSHA Consultation that might provide some help. They are OSHA inspectors, but they come in under OSHA consult. They might not be OSHA inspectors per se. Sometimes they contract that out to people. They'll come in and do a walkthrough of your facility and give you some advice. And I have used them with good success. I've heard some horror stories about them too. And they can't write you up. They can't report you to OSHA unless they find something very serious and you don't do anything about it. They can and will report you to OSHA, but it's rare. But you might want to get somebody in upper management to agree to before offering somebody from OSHA to come into your plant. The workers' compensation insurance carrier probably has a loss prevention department that will be glad to help. They probably do. I'm guaranteed they do. Workers' compensation, what's best for an insurance carrier? Less claims, right? How do you get less claims? Better safety. So the workers' compensation carrier is on your side. Our workers' compensation carrier at OK Foods, we had I don't know, for some reason earned some I don't know what you call it, goodwill or something, but they sent a consultant free to us to help us out on our process safety management. And boy, I tell you what, I take advantage of all the free help I can get. Networking with other safety professionals is always a good practice. Safety professionals tend to share their failures and successes with other safety professionals because we all kind of want the same thing. So that's it for this one. Take care. See you later.